Welcome to episode number 11 of the Digital Health Voice. We're happy to tell you that we've been featured in the top 25 digital health podcasts. And with that in mind, we know that we have a bigger responsibility to share with you more and better information on digital health through our podcast. And today, I'd like to introduce you to Tjasa Zajc. Tjasa, you might know her very well as the host of the Faces of Digital Health, an extremely popular podcast in this field. And most of all, though, she has another interesting role, which is that of being a Better Meds business developer, which goes into patient safety and medication management. So let's explore in the video interview / podcast. Go for it. So welcome, Tjasa Zajc. Wow, you're with us. We're really lucky to have you. Honestly, Tjasa, you don't know how much, how honored to have you with us. First of all, because you're a first-class podcaster, hands down to you, and I'm learning every day from you. And also, secondly, because you have a wealth of knowledge. And the wealth of knowledge comes from speaking to people. And I'm really inspired by your actions. And I'd like to introduce you today to our lovely audience that we're building as well. And with this in mind, I wanted to say that Tjasa, first of all, you all know her for being the host of the Faces of Digital Health. But as well, today we'll also explore a bit into this. She's also the business developer of Better Meds. This is something she might be less known of, but she has a definitely interesting role because she's enabling a lot, especially when it comes to e-prescription, I believe. Is that correct?
Yeah, I can explain a little bit more a little bit later.
Yes, I'm really looking forward to this. But Tjasa, this is all about the digital health journey. How has it been for you? Like, I still remember way back when we met in Ljubljana for the very first time. I'm not sure if you had done about 50 episodes already. I can't remember exactly, but I remember like that your digital health journey goes way back. So tell us about it. How did you end up in digital health?
So I was a healthcare medical journalist before diving into healthcare IT. And my work as a journalist was focused on reporting on latest clinical guidelines, changes in clinical guidelines, new therapies. So very clinical work because the content was focused for doctors. We would go to medical congresses to report on novelties in therapies. And that gave me a little bit of understanding of some of the fields in medicine, which is huge. And at the same time, in 2005, I started noticing how technology is entering healthcare with a rapid speed and how it's going to play an increasingly important role in healthcare. I, at that time, was also an audience developer for the media outlet that I was working for. And we started doing podcasts, and I wanted to do one on digital health. And that's how basically my journey began. That was 5 years ago. I'm approaching 200 episodes. So yeah, quite a few discussions behind me.
Yeah, so that's incredible. 200. Wow. Will we ever get to that milestone? I'm not sure, but most probably by that time you will be at your 500 episode. But definitely there has been a lot of work into that, and it's interesting also because we really had the opportunity in the previous podcast. We had the opportunity to talk to an engineer. We had the opportunity to talk to someone who started off in political science. So really, what I'm noticing the more and more is that the different sciences and the different professions are slowly and steadily coming into healthcare. And that's beautiful because that's what we really need in healthcare. We don't really need only the view of the medical doctor. We don't need only the view of the nurse. We don't need the view of only the healthcare professionals working, but we need the view of multiple people, multiple experts who can help us deliver better patient outcomes, if anything, to deliver a much better user experience. But I'm really curious about Better Meds. I know that you work with Better as well. But tell us more about it. Like, how did you make the experience work for healthcare professionals and healthcare organizations? Like, what's your experience there? Like, do you have some interesting case studies that you can share with us? Possibly some big wins?
Sure. Yeah, I can explain that. So basically, Better is an IT company, healthcare IT company that is offering the market a market-leading platform for data management based on the open EHR standards. And among the things that we do in the company is also developing a medication management system for hospitals called Better Meds that you mentioned. So basically, Better Meds is something that doctors, nurses, and pharmacists in the hospital would use for medication management. So now I think that sounds much simpler than it actually is. But if you imagine when you enter the hospital, the doctor first needs to get your medical history. He needs to see what kind of medications you were taking so far. Then that has to be put in a system. The pharmacist needs to check if everything's okay with the medication, has to cross-reference the information with the previous sources, so potentially primary physician and other hospitals that you visited before that. So creating the whole list of medications is a huge process on its own, medication reconciliation. And then the same system is used by nurses when they need to administer medications. And if you imagine having 10 patients with 15 different medications, each of the medications with different doses, different routes of administration, the complexity just gets bigger and bigger. In the US, a lot of hospitals are already using barcoding to check which medication goes to which patient, so you make sure that the right patient gets the right medication. However, in many places, the hospitals are only starting with electronic medication management. The basic aim of medication management done electronically is to decrease errors with prescribing, to decrease errors with medications, and in essence, create better patient safety. And clearly, when we're developing these systems and trying to improve them, the aim for us is to also care about the users of the systems, so that healthcare providers are not overburdened by these systems, which is a huge problem in healthcare IT, as you are probably aware.
Yeah, I mean, it's interesting that because I think we do have, as medical professionals, we do have a bit of a love-hate relationship also with technology, and also we have a love-hate relationship with paper. So it's, paper is sometimes something you can touch, something, and there still is that mentality in multiple countries, not just in countries like where there's some like this difficult detachment from this something to touch, the paper, and the mod actually. Interestingly enough, we did start with robotic dispensing, and we did start. There are some pilot programs going on in different wards. It hasn't been straightforward, mind you. We did have some hiccups, and I think we're still learning as well, because when you work with different providers, when you work with when there is also a bit this things happening back and forth, it can be a bit challenging. It's not impossible, but sometimes you'll face these changes as with any other implementation. So this is something that I think, even though around the world we're having like electronic e-prescription becoming so widespread, we still are facing challenges. So it's not something like, oh yes, pandemic helped, definitely, because even we don't have a full national e-prescription. We have in Malta, we have like a reimbursement of electronic reimbursement, and you can pick it up from your own pharmacy. That's extremely convenient. But as such, doctors still write prescriptions up till now. Let's hope it changes soon. But But because of the pandemic, then we had to kind of look at electronic, like accepting a photo of a prescription rather than the actual paper. It had to happen. Otherwise, there were people who would have been stuck without medications. So there is this bridge happening until we get there, which is very, very interesting. And I'm gonna follow this closely, and I'm gonna push as much as I can for us to consider having a national e-prescription system, because it will benefit everyone at the end of the day. To understand the full healthcare journey. And I'm sure you can tell us a bit more about that. Like from what you've seen, is there like a story in particular which really struck you, Tjasa, from your work? For example, it could have been a patient who received their medication on time. Do you have some story to share with us?
Oh, I mean, I've got plenty of stories to share, because after all, I'm a chronic patient myself. And last year, I even recorded a documentary about medication management called Overdose: How Can We Prevent Medication Errors? It's in that documentary, there's 10 speakers included from various countries across the world. We even had a panel discussion after the movie premiere. So in the end, you've got 15 experts talking about medication management from 10 different countries. And that documentary really gives you an overview of the problem from the patient, doctor, nursing, and pharmacist prescribing. So medication management and medication errors is a really huge global challenge. If I just tell you a few numbers, globally, the cost associated with medication errors is $42 billion US. We with Better Meds are mostly present on the UK market, and the estimates that are not that old for the UK are that there are over 237 million medication errors happening every year, and cost 1,700 lives. So this is still, a huge challenge that needs to be addressed, and patients can actually play an important role in that, in making sure that they are mindful of what kind of medications they are taking, what kind of medications are given to them when they are in the hospital, because hospitals are a really hectic environment. And mistakes can happen really easily. So, many parents will be able to identify with this. But, if you imagine that you're in the middle of doing something, or potentially even trying to do 2 or 3 things at the same time in your household, and you got a 2 or 5-year-old, or even 2 or 3 kids, and somebody just, comes by to ask you something, and you can reply to that, but then you're going to immediately forget what exactly was it that you were doing, or you're going to start doing something else and come back and figure out, oh, this is what I was doing like an hour before this. And I'll translate this not tension, but this dynamic into the hospital environment, where maybe you've got a nurse that needs to give out medications to 10 patients, and it can very quickly happen that there's an error. A patient doesn't get a drug, gets a too high dose of a medication. The packaging of medications are sometimes too similar. If you don't use electronic systems and things are written on the paper, somebody might think that 10 milligrams is 10 grams. So, you've got a really huge overdose. And it's just challenges like this that contribute to medication management being such a patient safety issue that we still need to raise awareness about. And that is something that I was also trying to address through the documentary. I can stop there, because otherwise I'm gonna talk for the whole afternoon.
No, it's wow. I mean, look, we talk to people, at the Digital Health Voice, because we have so much to learn from you. If we were like an echo chamber, if we just talk to ourselves, like whoa, we'll just hear our same voice and we won't really learn anything. So that's why it's amazing that, first of all, I'm really happy now, because now not only you don't only do podcasts now, Tjasa, but now you're doing like even some movies. So that's really cool, like you're expanding your horizons. And I even I wanted to hand you like a big thumbs up, because I remember like with the transition, when you transitioned from podcast to doing more video interviews. That was so cool. And I think that happened during the pandemic. Is that correct? Or it happened
Um,
before? You started
mm,
before?
no. It was during the pandemic. It was just,
Yeah, okay.
it's the podcast is my way of still being in touch with the journalistic skills. I love being a journalist. I love the opportunity to talk to experts and debate about topics. I think it's the best way for anyone to learn. It's also very labor intensive, very time consuming if you want to do it well. So I like to prepare for my interviews because, as a journalist, I still remember we were told by one of our professors, when you talk to somebody, don't let that discussion be a discussion anyone can do. So, don't just go with the questions that come to mind. First, do your research, do your background research, learn about the topic so you'll be able to talk to the person that you are interviewing. And that's what I'm also trying to do. And, as part of running a podcast for 5 years, I'm obviously experimenting with the way I can expand the audience and present the content. That's why I also started doing a little bit of experiments with video. And instead of just publishing pictures of the speakers that talk on the show, I just also publish short clips from the discussion so people can see one interesting thought from that whole discussion and decide if that's a topic they would like to hear more about.
Wow, so cool, honestly. And with that in mind, I wanted to kind of open the floor a bit as well. So we're seeing more digital health podcasts coming into the forefront. And it's interesting to see, there were lists of digital health podcasts, like the top digital health podcasts. We have a health podcast network. You all know Daniel Kendall with his very, very interesting health podcast network. So how do you see the future of podcasts in digital health and MedTech possibly? How can you see it contributing back to the evolution of digital health? How even not possibly just digital health, the actual products, but even digital health policy possibly, or digital health legislation for all I know. It might have such a big impact. Like, how do you see the future evolving?
So the main kind of benefit of podcasts that I see is that when we speak and also when we listen to discussions, the perception can be different from the written word. So if you look at a movie, or if you listen to a discussion, or if you read an interview, you might take something different from each of these mediums. So from that perspective, podcasts offer the opportunity for speakers to give the audience and their network a different insight about themselves, about their expertise. So, me personally, when I do interviews, I always use a podcast, the podcast app on my phone as a search engine to try to figure out if the speaker that I'm going to talk to has already done any interviews, to learn what they already said, because I always think of the added value that I can add, to my audience. I try to create questions that already give the audience some information so the speaker can build up on what has already been told. And in that sense, in a shorter amount of time, the audience can get more value than if I just gave the speakers basic questions about who they are, what they're doing. And this is potentially a speaker that's already been on 10 podcasts, and everybody, and it's just he or she is just repeating what he or she has already said elsewhere. So to summarize, podcasts are a new way of getting educated. To some extent, they can be very convenient to listen to compared to books. You need to sit down and listen to books. If you do chores at home, you can do that with earphones and listen. That's what I do. That's how I get my audio content. And that kind of makes me feel that, I'm not out of touch with the trends.
I think last week, I'll be honest, I was at the gym and I was really lucky because there was someone who told me, like, I listened to you, whilst I was doing my errands at home, and I was like, wow, like, I never thought, that we could reach could reach someone in their own home. I think that's so beautiful, and it's also, there's some responsibility that we need to make sure that we're informed. And in this day and age of misinformation and disinformation, as we heard just this week, there was the whole debacle on Spotify, and the challenges that there were happening there. So we really have a big responsibility to make sure that as much as possible we share good and quality information on digital health. And believe it or not, Tjasa, we're actually coming to the end of the podcast, podcast/video interview. I can't believe it. I mean, I think this is when there is this interesting discussions, I really get some time also to reflect as well. So what you've said, there were some amazing golden nuggets of wisdom as well, on how important it is to develop quality conversations. And more than ever in healthcare, if you want to create impactful change, you need to have that conversation. Sometimes a difficult conversation, not an easy one where you're going to tell that person, oh, we're just going to keep on doing the same old thing that we've been doing for the past 20 years. No, it might be the chance that there will be need this change. But then there's an opportunity for something beautiful to come out of this. And you have an opportunity for 1 minute. You already started raising some awareness, which is really cool. But you have 1 minute. The floor is yours. I will try my best not to interrupt you, because it seems I have sometimes I'm very good at interrupting people. But you have 1 minute, and you can raise awareness on any topic of your choice. All yours, Tjasa.
I would like to continue about patient awareness and how can we be better patients, which I started before. There's a book that recently came out by a psychologist, Talia Miron-Schatz. It's titled "Your Life Depends on It," and it talks about medical decision making. And the key takeaway from that book for me was, when you're a patient, when you are stressed out in a medical setting, it's really hard to be rational. And then a doctor tells you something, you're going to forget 80% of what the doctor said, and you're going to come home, and maybe your loved one is going to ask you 10,000 questions, and you're going to be like, I didn't ask any of those. So the advice or the raising awareness part that I want to emphasize is to practice 3 questions from this book. And the questions are, when you're faced with a treatment or a new drug, ask the doctor, what are the risks? What are the benefits, and what's the alternative? And this is really important because, also when it comes to medication management, mistakes can happen so very quickly. And we come to the hospital thinking that we came to a safe place. And that may not be the case, not because the clinical staff wouldn't be professional, but just because, as I mentioned before, the environment is hectic. So as much as you can, be mindful of what's given to you, what you're taking, and just take your part in the capacity that you can, in just being that last safeguard regarding the treatment that you're getting, because this is basically what we're talking about in the 21st century healthcare: collaboration, being an active participant in care, not just a passive recipient of paternalistic care.
So, risks, benefit, alternative. Now that is something I'm definitely going to take from this conversation. And I think, one of the most important things that digital health needs to achieve is to relay the information at the right time and at the right context. So, with that in mind, Tjasa, I bid you farewell, but also see you later. And maybe I'd love to see you in Malta, Tjasa. So I'm extending this invitation this year to see you in Malta at MedTech World. I hope that we'll be able to have a coffee together where we can continue discussing on the future of digital health, but even possibly on how to, make it even better for the patients, for the caregivers and to take digital health possibly to the next level. Well, so the Digital Health Voice is expanding, and now you can even find us on your favorite podcast app. So we are on Overcast, Anchor, Pocket Cast, Radio Public. I think I'm losing count of how many we are. But also don't forget to follow us on our socials. So we're on Facebook, Twitter, LinkedIn, and Instagram as MedTech Word. So we definitely want to see you there. And also keep in mind that this year we're going to have MedTech Word 2022. So start getting ready, start preparing, doing your preparations, and maybe we'll see you in Malta too. Cheers, grazie u saha.